What's up, guys? Dr. Shepard here, and today we are going to be talking about the symptoms of depression. Oftentimes, I see people who have been dealing with major depressive disorder for a while and didn't realize it, because oftentimes we have these symptoms and think of it as just burnout or stress or even just normal human experience. And yeah, these symptoms are certainly possible in people who don't have depression. But in those individuals, we see that the symptoms don't last for very long and they aren't bad enough to disrupt your day-to-day life. In contrast, if you have major depressive disorder, you will see these symptoms more days than not for at least 2 weeks. And the symptoms will be bad enough that they start to get in the way of your ability to function at school, at work, or they might interrupt your home life, your relationship with friends, all of that stuff. The other thing that's really important to know about depression is that it's not just about sadness. In fact, many people don't even feel particularly sad when they're dealing with depression. Sometimes you just feel numb or blah. It's more of a feeling like nothing's particularly interesting or exciting anymore, and the world just kind of goes from being in full color to being in black and white. So without further ado, let's talk about some of the most common symptoms of depression. This is not an exhaustive list, so you may be experiencing symptoms of depression that I don't talk about in this video. Let me know in the comments whether there are specific types of symptoms that you'd like me to talk more about. But at least this gives you a list to kind of start you off. Follow on my other socials if you want more information on depression. And of course, as always, talk with your doctor or therapist if you're worried or have any questions at all. This is educational, but it's not medical advice. Now, I'm going to talk about a whole bunch of different symptoms of depression, and these are things that I commonly see in my work as a psychiatrist. But this is by no means an exhaustive list of all of the possible symptoms of depression. Depression can look like so many different things. And that's why it's really important that if you worry that you may be experiencing depression, that you talk to your doctor, you talk to your therapist, and find out if some of the symptoms that you're experiencing may be due to your depression. So symptom number 1 is a change in your sleep pattern. In depression, we can see either an increase or a decrease in sleep. So you may be someone who, when depressed, sleeps a lot more than you usually would. And oftentimes this sleep is not very restful. So you might be in bed for 12 to 16 even hours a day, but when you wake up, you really don't feel well rested. Other people may sleep less than usual. So sometimes people have trouble falling asleep when they're depressed. Sometimes they have trouble staying asleep. Sometimes they'll even wake up very early in the morning, like 3 or 4 a.m., and then have a lot of trouble falling back asleep. Again, this does not make for a very good night's sleep, and so people end up waking up exhausted, which leads to symptom number 2, which is a change in your energy level. When you're depressed, your energy level tends to plummet. Every little thing that you do feels exhausting. People can get so frustrated with themselves because they feel like simple things like taking a shower or getting dressed for work are completely exhausting, and they don't understand why. But depression is a huge energy suck, and like we just talked about, your sleep is probably not going to be normal either, which makes the energy problems even more magnified. Depression symptom number 3 is feeling more irritable. When you are depressed, your fuse tends to get really short. So many people with depression will lose their temper very easily. They'll become very frustrated with sort of minor inconveniences, and they may get very angry very easily. Oftentimes, people with depression end up taking their irritability out on the people that they love the most. And this can be a really upsetting piece of depression because people feel so guilty for the things that they do or say when they're feeling really irritable. It can really end up doing some serious damage to your relationships. Symptom number 4 is an increase in anxiety. So a lot of people think of depression and anxiety as 2 separate things, but really they tend to be very intertwined. So it's actually really common for people with depression to notice an increase in their anxiety level as well. Sometimes this can manifest as just worrying more, so thinking a lot about what could possibly go wrong, all of the possible negative outcomes, or it could manifest as some of the physical symptoms of anxiety. Things like feeling like your heart is beating really fast, having headaches, feeling muscle tension, nausea, diarrhea, or you can even develop full-blown panic attacks. Sometimes the anxiety gets to the point where you actually start avoiding things because the anxiety is so bad, and it can kind of take on a life of its own from there. Thankfully, most of the time when we start to treat the depressive symptoms, the anxiety symptoms get better as well. Depression symptom number 5. Feeling guilty or worthless. People with depression typically have what we call a change in their self-attitude. This basically just means that people have a change in the way they see themselves, in the way they see their positive attributes, their negative attributes, and the various characteristics that make them who they are. And as you can imagine, this self-attitude and this view of oneself becomes very negative in depression. I kind of describe it to people like putting on a pair of blue-colored sunglasses. When you look around, everything's going to be tinted blue. It's not that your desk and your chair and your computer are actually blue, but putting on the glasses makes them seem as if they are that way. It's the same thing with depression. You put on your pair of depression glasses and you see yourself as sort of a distorted version of who you actually are. And this version can be very negative. You start to think of yourself as a bad partner, a bad parent, a bad friend, a bad child, a bad sibling, someone who isn't doing a good job at work when in reality all of your reviews say otherwise, or you start beating yourself up for being a bad student. It's really common for people with depression to start to beat themselves up about every little thing. And they also start to feel guilty about a lot. They feel guilty about things that they really have no control over, even things like their depression symptoms. So I hear people say all the time, I should not be feeling this way. My life is actually going pretty good. My family's really supportive. I have a good job. Why am I feeling so depressed? And they feel so guilty about these symptoms. They feel like they're a bad person because they're feeling depressed. In reality, that's just another facet of the guilt that depression tends to bring on. Depression symptom number 6 is a change in appetite. And just like the change in sleep, your change in appetite could be an increase in your appetite. So people with depression can start eating more than usual. They can start feeling hungry all the time. They may start to crave comfort foods or sweets. And this can even lead to a significant amount of weight gain. And on the flip side, people with depression can also lose their appetite. So they may start to feel like they are never hungry, or even if they are hungry, when they look for something to eat, nothing seems appetizing. They often find that they have to force themselves to eat just to keep up with some of their nutrition. And this can also lead to a significant amount of weight loss. While it's uncommon, some of the changes in appetite with depression can actually lead to pretty significant nutritional deficiencies. So this is one of many reasons why your doctor will often request that you get blood work when you are getting checked for depression. We're checking for not only things that may look like depression, but may show up in your blood work, like thyroid problems, but also looking for some of the nutritional deficiencies that can come along when your appetite is really poor or you're just not taking good care of yourself. Like we talked about earlier, doing simple everyday tasks with depression can feel incredibly difficult, and so you may find yourself just eating ramen every day or heating up a freezer meal because you can't find the energy to prepare a nutritious meal. And some of these vitamin deficiencies can actually cause your mood to worsen. So it's important that we find them and start to treat them as soon as we can. Depression symptom number 7, low motivation. Motivation is a huge issue for people with depression, and it can start first thing in the morning. The second your alarm clock goes off, you probably find yourself thinking, I can't do this again. And it can take all your willpower just to get up out of bed in the morning. I find that people with depression start feeling like everything is a chore. So even the things that they used to enjoy or used to find were pretty easy for them start to be really difficult. For example, sitting down to do their homework after school, maybe that's something that they didn't necessarily love before, but they could always muster up the motivation to sit down and do it. With depression, it becomes nearly impossible, and they start falling behind in their classes. Depression symptom number 8. Difficulty enjoying things. This goes along with the low motivation. You find that the things that you used to love or used to be easy for you are no longer things that bring you any joy. It might even be things that you loved, like a certain video game, spending time with your friends, spending time with a family member. You start to have trouble enjoying much of anything. And you may start to find that the activities that you once loved actually become a chore. So oftentimes what this means is that we start to isolate ourselves. We start to retreat from other people. We stop doing the things that we love, and we find ourselves just sort of being by ourselves a lot and doing something mindless like scrolling on the internet or watching YouTube or getting lost in a video game or TV show and just not really enjoying it that much. Depression symptom number 9. I'm running out of fingers. Trouble concentrating. Difficulty concentrating is so common in depression, and it can actually get to be very severe to the point where it can really impair your memory. If you can't concentrate on what's going on around you, then you don't store the memories that you need to be able to recall them later. And this can get so bad that people sometimes think they have a dementia like Alzheimer's disease. In fact, the memory problems caused by depression used to be called pseudo-dementia. Pseudo meaning false, referring to the fact that this looks just like dementia sometimes. Problems with focus and memory in depression can get so bad that you feel like you can't focus to read or watch a TV show or even carry on a conversation with someone. And of course, if you're having this much trouble concentrating and focusing, then your performance at work or in school is probably going to suffer as well. Depression symptom number 10 is sexual problems. As you can imagine, if you're feeling depressed, you're probably not going to be that interested in sex. And we notice that people have a significant decrease in their sex drive when they're depressed. This can manifest as just loss of libido, so no longer being interested in sex, or it can manifest as difficulty having an orgasm, or difficulty getting or keeping an erection, difficulty with vaginal dryness. So in other words, a whole bunch of things that can make sex not only unpleasant, but also pretty uncomfortable. Thankfully, usually when we treat the depression, these symptoms also get better. But one common treatment for depression is the use of antidepressant medications. So medications like SSRIs, or selective serotonin reuptake inhibitors, or SNRIs, serotonin and norepinephrine reuptake inhibitors. And unfortunately, many of these medicines have a risk of causing sexual side effects. But thankfully, there is a lot that we can do to try and treat or address these problems if they do arise when you start a medication. So definitely mention it to your doctor if this becomes a problem for you. All right, I really did run out of fingers. But depression symptom number 11 is feeling slowed down. People describe the physical feeling of depression as a feeling of heaviness. Sometimes your limbs feel like they are physically heavier. You might feel like you're moving through concrete or quicksand. You might feel like you're slower all around, like your thinking is slower, your physical movement is slower. You may feel generally sluggish and have a lot of trouble just physically getting off the couch or walking distances that used to be no problem for you. Sometimes these feelings of heaviness and slowness can be so bad that other people can actually pick up on it and will notice that you are moving, talking, and thinking slower than you normally do. All right, last but definitely not least is thoughts of death or suicide. If there's one takeaway from this, it's that I want you to know that if you are having thoughts that life is not worth living, or that you'd be better off dead, or that suicide is an option for you, those are not normal. They are a sign that you need to get help. You need to talk with a professional because there is something going on. It could certainly be something else, but oftentimes that something is depression. And sometimes people get to the point where they feel so hopeless that they start to think about harming themselves or even killing themselves. And if you find yourself in this spot, I want you to know that things can get better. It may feel hopeless right now. It may feel like things will never get better. But I've seen so many people that recover, that get better, and you can absolutely be one of those people. But you have to stay around long enough to get the help that you need, and you have to reach out to a professional. If you are in this state, please check the links below. I have links to a lot of different resources that you can use to get the help that you need. If you are currently thinking about suicide, please call a crisis hotline in your area. These are trained professionals that can help talk you through some of what is going on. You absolutely deserve to feel better. And the one silver lining of these illnesses is that they are treatable. They can get better. In my entire career, I have never come across someone who we couldn't help in some way. day. It's hard work, and oftentimes it takes us a while to get it right, but I promise that there is hope on the other side. And that goes for all of these symptoms. There's always something that we can do to help. And if you feel like you're not getting the help you need, keep reaching out. If you can't afford help, I have some links to free and low-cost resources on my website. And most importantly, just don't give up, because you are worth fighting for. I've been there, and I can say as a doctor and a patient, it gets better. Sending you lots of love.